Hi there, it's Rebekah Mustaleski, Midwife and Compression Director with Motif Medical, and I want to talk to you about the postpartum. So much time during a pregnancy is spent thinking about how to stay healthy while you're pregnant and getting ready for labor and birth, but there's this whole time afterwards of the postpartum. So what do you do in the postpartum? What should you be ready for? The big thing you should be ready for in the postpartum is change. There's a whole lot of change that happens in the postpartum. There's body changes that are going to be happening. Your uterus is going to start contracting and go back to its normal size within the first couple of weeks. Your body is going to start producing milk, and that milk is going to come in sometime around day 3, and that is going to cause some pretty significant breast changes. Your sleep patterns are going to change quite a bit. Babies wake up and feed every 2 to 3 hours, so you're not going to be getting a consistent night's sleep. It's all going to be broken up a little bit. All of these changes are in addition to the hormonal changes that happen during the postpartum. There's a huge shift in hormones that happens once your baby is delivered, and those hormonal changes are what lead to what's called baby blues. And baby blues is sadness that comes and goes, and it's normal for that to happen in the first couple of weeks postpartum. Sometimes those hormonal shifts, though, lead to postpartum depression, and that is not considered a normal thing. Sometimes those hormones will just get out of whack, and they need a little help getting back into balance. So if you are postpartum and you find yourself dealing with depression, sadness, thoughts of overwhelm and anxiety all day long, please know that that's not normal, and please reach out to your healthcare provider for assistance. If there was one word that I could have you focus on during the postpartum, it would be nourish. I want you to think about nourishing yourself and nourishing your baby, and that's it. You really need to focus on resting for at least those first 2 weeks. Now, I'm not saying you have to be confined to bed, but you really don't want to be doing any housework or cleaning or cooking or preparing foods. You need to let your community pick up that role for you and take care of you during those first 2 weeks. Your body has been through a lot, both during pregnancy and during the delivery, and it needs time to adjust to this new postpartum self that it is. And the only way that it can do that is if you rest and take it easy. So eat healthy, nutritious, delicious foods. Bone broths are great, soups are great. Make sure you're eating lots of fiber, as that's really important during the postpartum. And then nourish your baby, feed your baby, be close to your baby. Your baby's whole world has been turned upside down during birth. Everything is now different from what your baby has known for its entire life, and that takes adjustment. So hold your baby close. You are the only thing that is familiar to your baby. Keep them close, both while you're feeding and while you're not. I promise you, you cannot spoil a baby. They need that love and comfort from you to feel secure in this new world that they've just entered. And the last thing I really want to talk about today is support from your family and friends and community. We live in a culture and a society where it is not the norm for us to ask other people for help. But I want you to know how important that is for you to do during the postpartum. This is the time when you need the people around you to help you transition into being a new parent. It will not be an easy transition if you try to do this all on your own. You need people around you to help provide for your physical needs, your family's physical needs, and help you be able to provide for your baby's physical needs. So really call on the people around you to help take care of the day-to-day activities that you can't do right now, to help provide for you and your family and your baby, and take this time to just rest, because that's all you need to do in the postpartum is rest and feed your baby. Thanks for hanging out with me today. If you have any more questions, you can find more information over on the blog at motifmedical.com/blog. Thanks.